In nursing school, we are all taught about hypertensive medications and how to categorize them into certain groups so that it's easier to recognize when it comes to test taking, like beta blockers end in that suffix LOL, or that calcium channel blockers for the most part end in that suffix PINE, or that ARBs end in that suffix sartan. And while this is helpful information, it is not complete information, because what should happen if you come across an antihypertensive medication that does not discretely fall into one of those categories? Then what? Then what? This is why it is imperative as nurses, especially student nurses, that you learn medications and understand pharmacokinetics and pharmacodynamics so that you're not left with just memorizing for the sake of pattern recognition, because sooner or later you're going to come across one of these medicines that doesn't fit into one of those categories. And I got one for you today. Let us talk about Labetolol. On the surface, you're probably thinking, oh, it ends in LOL. That means that it's a beta blocker. Not 100%. No, ma'am, no, sir. Labetolol is one of those very unique antihypertensive or blood pressure medications that falls into two categories. Labetolol is both a beta blocker and an alpha blocker because it works two ways. This is what's called pharmacodynamics. How does this medicine work in the body? Labetolol works by blocking beta 1 receptors and beta 2 receptors for that matter, but it works by blocking beta receptors, which tell the heart rate to slow down. That's the beta 1 receptors. And it definitely works on the beta 2 receptors, which are found in the periphery as well as in the lungs. Beta 2 receptors are not only found in the lungs, they're actually found in smooth arterial wall muscle also. So on the beta 2 receptor cells of the arteries, the Labetolol tells them to dilate, relax, just relax. Labetolol also is an alpha 1 blocker in that it helps promote that smooth arterial muscle wall relaxation, bring down the heart rate, relax the smooth walls of the arteries, and that decreases peripheral vascular resistance, ergo blood pressure will come down. Who's a good candidate for Labetolol? You have some, 100%. Obviously, patients who are in some sort of hypertensive crisis state. Labetolol comes in both oral form and IV form, and it's the IV form that